Dr. Chavez, pulling wisdom teeth. First of all, let me ask you something. Do wisdom teeth add to your wisdom? I mean, yes, no?
No. The reason they're called wisdom teeth is they tend to show up approximately around the age of 21, which is...
That's when I did the most stupid things in life. What are you talking about? I mean, that was my stupidest time of life. I'm glad I survived it. I'm unlucky I survived it.
I understand. So that's the reason why they're called wisdom teeth.
Got it.
You know, everything in dentistry has become much kinder and gentler. We're now able to relatively easily, and certainly there's no reason for pain, to remove, no matter how complicated your wisdom teeth are. And we have great techniques for controlling inflammation, discomfort, post-surgically, so that you can actually get on with your life, go back to work, and not be debilitated. There was a period in time...
Go back to your life, how fast? Like,
well,
you get it pulled today, can you go back tomorrow?
Yes. I would say most of my patients that I remove wisdom teeth on actually leave us and could actually go back to work. I'd say half of them go home just because they still have some redness, a little bit of oozing.
They planned it that way. They said, look, let them make the last thing of the day.
Certainly the next day.
Yeah.
Certainly the next day they can go back to work. The only contraindication going somewhere immediately afterwards is you may continue to ooze some blood, and it may be unsightly for you to be at work, or to, you know, depending on what you work, especially if you like working in the food services preparation industry. You don't want to see you bleeding out of your mouth.
Maybe your bank or a teller and have lots of, you know,
exactly. But as far as discomfort is concerned, we're really good. We've really developed techniques to manage all this, to make it as minimally invasive and to make it as minimally uncomfortable post-surgically. Certainly during the operation itself, you should have zero discomfort. You should be completely comfortable throughout the whole procedure, from start to finish.
Even if what you guys call an impacted one.
No, that's what we're talking about.
I'm talking they're about. All impacted or what?
I'm talking about, you know, teeth that are lying sideways in your head.
Yeah.
Yeah.
Got it.
Yeah.
So, and do they have to come out? Let's just say a wisdom tooth is in there straight, not growing this way. There he is. Do they all have to come out, or is it like a person-to-person call?
It's definitely a person-to-person call. I'm a minimally invasive dentist, so I would not want to take out a wisdom tooth unless it's causing you an actual problem. And just because your wisdom tooth is impacted, just because your wisdom tooth is not erupted and you're 26, doesn't mean you're going to have a problem. I have many 80-year-olds with impacted wisdom teeth that are doing just fine. They don't have crooked teeth and don't have a problem. And why would they have to go through a surgical procedure if they didn't have to? And the cost. You've got to remember these things.
Right.
So it's all on an individual basis. Now, many times an orthodontist will say, please remove all of the wisdom teeth. And then I'll do that because he's asked me to do that. But unless I'm seeing that there's a specific problem that's being caused by this wisdom teeth, or the patient, occasionally the patient will be in pain, there'll be infections forming there, then you really need to take him out, and then you take him out.
Got it. Do you have any theory, whether it's a knowing type of theory, why is that something that there's not space for all of our teeth in our mouth? I mean,
well, yes.
What did our creator do here?
Oh boy, now you're getting to deep waters.
Yeah.
Listen, there are theories. One of the theories is that we as humans have changed the type of diets we used to have. So we've included a lot more sugars and grains and refined foods and things like that have impacted the way we use our mouths and the development of our jaws. And so there's a belief out there that the fact that we've changed our diet has actually changed the size of our maxillas and mandibles, and we're actually becoming shorter. And So that's the
I see.
philosophy that's
So
out there.
basically, just like the normal evolution, this is part of it. We're kind of witnessing it here. You know, I guess we're not ripping off raw meat from beef anymore, but putting soft donuts in it, and so those somewhere
Yeah.
along the line that they
Yeah.
say, well, we're not needed anymore.
Yeah, refined foods and sugars also have a big impact apparently, but
That's not here and there. What it is what it is.
These are philosophies.
Right.
Yeah.
Got it. Thank you very much.
You're very welcome.